When your patient comes out of the operating room, they're going to go to recovery. In some cases, they're going to go to the post-anesthesia care unit, also known as the PACU. So providing immediate anesthesia recovery care in the PACU will normally start with identifying your patient. Two patient identifiers, usually the name and the date of birth, and by their wristband. That's important to check because you can't really ask the patient their date of birth. Most of the time they're going to be under some type of anesthesia. Then you're going to receive your handoff report from the circulating nurse and the anesthesiologist. You're going to review your surgeon's orders, consider the type of surgery that the patient got, whether to base your care off of that surgery. You want to know what the surgery was, as well as what kind of anesthesia they got. That's going to determine the level of care they're getting from you in the PACU. Then you're going to perform hand hygiene. You're going to do a full patient assessment, complete head to toe. You're going to do your vitals. You're going to assess that all the criteria has been met to discharge the patient from phase 1 level of care. To continue caring for that patient. Then you're going to identify expected outcomes for your patient, what the goals are that you're anticipating. You're going to perform hand hygiene again. You're going to gather all of your equipment and, for continuous monitoring and care activities for the patient. Then you're going to start completing your doctor's orders or the surgeon's orders. So hook your oxygen tubing up to the regulator. You're going to continue IV fluids. You're going to monitor the patient's catheter, remove it if it needs to be removed, or just monitor that it is still draining if it doesn't need to be removed. You're going to continue an ongoing assessment and compare the patient's current status to their baseline status. You're going to maintain the patient's airway after general anesthesia, so usually with the oral airway. You're going to position the patient appropriately depending on basically what is going on with the patient. You're going to get an Emerson basin in case the patient has any kind of nausea or vomiting. That way it will be readily accessible. And then you're going to encourage coughing and deep breathing exercises as tolerated if the patient can do that. Suction the patient's airway or like the temporary airway or their oral cavity if that's necessary. When the patient's gag reflex returns, you can have them spit out the oral airway only when the gag reflex is returned though. And then you're going to avoid positions that aren't working for the patient. So if you have to avoid position changes, then that's okay in this part of the recovery. You want to just position them as appropriate or as tolerated right now. You're going to maintain your IV infusions and encourage fluid intake. You're going to talk to the patient as they start to wake up in a normal tone of voice. You don't want to be too loud or anything, just normal talk. Explain to them that surgery is over and that they're in recovery. You're going to assess their circulation by looking at nail beds, pulses, the color, the temperature of their skin. You're going to assess signs and symptoms of complications from the surgery. You're going to stay current with lab findings, and when the patient does come to, if they're under general anesthesia, you're going to introduce yourself again to the patient and orient them to their surroundings. You're going to continue to monitor the patient. Like if they have a different, other than general anesthesia, they could have a spinal tap or like an epidural anesthesia, which is usually from the chest down numbing. So you're going to monitor responses after spinal or epidural anesthesia. You're going to monitor blood pressure for hypotension. You're going to monitor for bradycardia. You're going to monitor for nausea and vomiting. You're going to keep the patient in the appropriate position and observe them in PACU until they've regained movement in all of their extremities. Again, you would be doing a full head-to-toe assessment, so you would be assessing their respiratory status, level of sensations, mobilities to their extremities, and things like that. You're going to monitor the source of intake and output for your patient. So you're encouraging fluid intake, but they also have IVs hanging. So that stuff is all going to be monitored as INO as well. You also have to monitor drains for INO. So if a patient has a wound drain, that would still be considered as output. So you'd have to observe those and document those accordingly. You're going to monitor dressings, reinforce pressure dressings, or change dressings as ordered. You're going to inspect the condition and contents of drainage tubes, collecting devices, things like that. You're going to document the amount that's in there, the color, and the appearance of that, as well as urine output. You want to document how much they're voiding and the color and basically consistency or appearance of that. The same with NG tubes, so any kind of lines coming out and going in are monitored for INO. It's very important to promote comfort during the recovery phase, so you want to provide blankets, provide mouth care, position changes if the patient isn't comfortable, anything that will help keep them comfortable, some pillows, socks, whatever the patient needs that helps keep them comfortable. Then you're going to continue monitoring pain and the patient's condition until it's time for them to transfer again. You're going to contact the anesthesiologist to approve of transfers or releases from the patient's room, provide written and verbal instructions to the patient before discharging them. So for the evaluation portion of this, you're going to compare all their vital signs with their baseline while you're caring for the patient. You're going to inspect the surgical wound dressings and drainage, measure INO, auscultate bowel sounds, make sure that the patient's still passing flatus. Sometimes with anesthesia, the bowels will be temporarily paralyzed just from the anesthesia. So sometimes it takes them a minute to start moving again. So that's something you want to pay attention to. And then their pain is obviously a huge factor. You want to make sure the patient's pain is well controlled and complete system-specific assessments as needed. Ask the patient to explain any signs or symptoms the best that they can and identify unexpected outcomes. And then, of course, you're going to document everything at the end. Patient's arrival, vital signs, pain, condition of tubes and drainage, all of that stuff will be documented. You're going to record vital signs in INO, and you're going to report abnormal assessment findings and signs of complications to the surgeon. And that is all for the immediate anesthesia recovery.